Yeah, there's only one person, Betty Goldston or John Alford, if you're online, if you could let us know.
Yes, I'm listening. Yes.
Okay.
This conference will now be recorded.
Okay, so Betty Goldston is calling number 3.
John,
I don't know.
John.
Unless he's forward.
This
I haven't heard him.
It's 2 minutes after 7. I will at this time call to order the Monday, January 4th, 2021 meeting of the Scotland County Board of Commissioners. And at this time, I will offer an invocation. Dear God, we have entered a new year, 2021, and we acknowledge the challenges of 2020, and we pray for a swift end of this pandemic. Included in our prayers is for guidance and wisdom as we continue to navigate the coming months so that we may reduce the illness and the death of the citizens here in Scotland County. As the duly elected officials, we accept our responsibility to act and decide in ways that are in the best interest of all the citizens that we serve. We pray all this in your holy name. Amen. Join me in the pledge, please. I pledge allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, at this time, we need an approval for our agenda.
So moved. Second.
We have a motion to approve and a second. All those in favor say aye.
Aye.
Opposed, like sign. Going into our public forum, we do have Mr. Adrian Lowry, who is with us. Mr. Lowry serves as the housing administrator, and he's going to bring us up to date on that program. Welcome, Mr. Lowry, and please take a minute or two to explain to us where you are now in administering these housing funds for Scotland County. I know there's been some changes since the last time we saw it.
Chairman, fellow commissioners, thank you for allowing me to be here for you this evening. I will, if Chairman will call, take just a brief moment. Back in December, originally I did work as the housing coordinator for one of our council governments, and we were very blessed to be able to administer several housing grants for Scotland County, EDSA, our single family rehab, CDBG grants over the years. Back in 2017, I did move from the Woodland River Council Governments to become the director of the Lumberton Housing Authority, where I've been ever since. I didn't do much with the programs, but I think there was a change in, a little bit of change in the guard at the top where they got out of the housing business. And a lot of these programs I was familiar with, so I did receive a call back in December from the North Carolina Housing Finance Agency, which is this program, asking, what was the status of Scotland County, because a lot of the funding documents hadn't been sent in. So I was able to contact Mr. Kevin, and Mr. Kevin was able to give me the information I needed. And so I decided to work on this program as a consultant to get it moving forward. Originally, I think the site was to do about 2 or 3 homes. COVID did slow us down a little bit, but I'm very pleased to let you know that in the 2017 Essential Single Family Rehab Program, we were able to get 16 families from Scotland County in that program that was originally designed for 3 families. At this particular time, 5 of those units have been completed. They've been inspected by the county. 6 units are currently under contract, which means work is going on now. And we have 3 units that we did close out the bid zone, and we have a closing schedule for January the 14th for those 3. So right now, it looks like we're going to complete about 14 units. Unfortunately, one of the families, Mr. Samuel McKinnis Jr., did pass away this year before we could get to his home, so he was removed from the program. And we have one other person who has a foreclosure issue that they're working on with their attorney, and the hope is that we can complete that unit. And if we cannot, we're going to move that over to the 2020 program. So it looks like, right now, we're anticipating doing 14 homes and bringing in Scotland County right around $522,000. I'll take a moment if there's any questions that anyone might have on this particular program. Also, very pleased to announce that Scotland County has been awarded a 2020 Essential Single Family Rehab Program, $190,000. We're looking to complete about 5 units in that program. Unfortunately, we can't do anything with that until we close out in 2017, which we're on track to do by June of this year. But I think the Housing Finance Agency is going to allow us to move forward on 2020 in the coming months. Kevin, the manager, is going to make a portal available on the county website. So all of the applications that we receive will go on the website. So anyone that applies will be able to go onto the county's webpage, be able to click on that link and see if their application has been received and to see where they're at in that process as far as the point system is concerned. So again, we're very excited about that program. Sometime probably in the coming months, once we get close to the end of 2017 program, we're going to get the media pretty good on this program, the radio station, the library exchange, to get the word out that these funds are available so we can garner as many applications as possible for this program. The program is a rehab program. We spend up for 2020, we can spend up to $30,000 to do any repairs to a home that might cause that particular homeowner to have to abandon that unit. Anything such as roofing issues, heating and air issues, a lot of flooring issues, bathroom issues. There are a couple of guidelines that must follow. There has to be at least $5,000 worth of repairs that are needed. The homeowner has to own the property, and there is a deed of trust that goes against that property for a period of about 7 to 9 years, depending on how much money we spend. And as long as the homeowner does not sell the property, that loan is forgiven at a rate of about $3,000 per year. So as long as that home stays within the family, they're never having to pay any money back. And it is a pretty good program, and the Housing Finance Agency has been operating this program in North Carolina since 1997. Chairman McCall, that's everything I have as far as an update. If there's any questions, I'll do my best to entertain those.
Thank you. Anybody have any questions?
Yeah, Mr. Lowry, this is Rick Gibson. Were any of these homes that were repaired damaged by the hurricanes?
No, sir. We did repair one home in the DR program. We did have probably about 12 to 15 applications. The rehab specialist is trained by Housing Finance Agency. He did go look at all those units, and he could not find any damage that related to the hurricane other than for one unit. But for those individuals, we did forward them into our application process. So when the 2020 program comes open, all of those individuals will receive applications for the new program.
Okay, thanks, sir.
Any other questions for Mr. Lowry? Well, thank you very much for being with us.
I don't have any questions.
John, Alfred John.
Okay, John, do you have a question?
No, I don't. I want to thank Adrian for that great report. That was information that I had requested through our county manager. And I want to thank you for giving us the information.
Okay, thank you for that, John. Okay. All right, next item is our consent agenda. Do I have a motion to approve?
Motion approved, consent agenda.
Second.
We have a motion to approve and second. All those in favor say aye.
Aye.
Opposed, like sign. All right, next tonight, I'm very pleased that we have Dr. Taquita LeGrand, the new superintendent of Scotland County Schools, to come and join us. We're here. across the room.
Well, thank you, Chair McCall. Thank you, commissioners. I appreciate your time this evening. Is it okay if I remove this briefly? No, it's not.
Sorry.
No, that's fine. I wanted to ask, I will keep it on. As stated, I'm Tequila LeGrand. I'm your new superintendent for schools here. But I first want to begin by thanking each of you for your service. Being an elected official, serving the county is a huge task, and it's a selfless task. So I thank you all for your service that you're providing here to Scotland County as a county in North Carolina. Also, as I begin my first 100 days here, each of you will likely be hearing from Ms. Meredith Bounds. While I'm here tonight to greet you as a group, I would like to meet with you individually, and due to COVID-19 restrictions, I'm open to a telephone call, a video meeting, or in-person meeting, whatever you are comfortable with. I would definitely like to spend time with each of you one-on-one. As I begin my first 100 days, I would like to share just a few goals that I do have in mind. And of course, you know, when you start collecting data, information, sometimes your needs assessments the information may change your direction. But right now, the direction I would like to head in will be to just learn more about the county, the strengths of Scotland County as a whole, including the school system, assessing the needs and the strengths of our students, our families, our staff, as well as our central office. And when I talk about our central office, we know the important role that you all play as commissioners for our central office and our school buildings and our local funds. So I'll be looking at our operational efficiencies in that area and our finances, and look forward to providing you all with an update on the things that I see, as well as what you see from your lens. So I just want to say I have an open door policy. You don't have to get on my calendar. If I'm available, my door is open. If you'd like to get on my calendar, feel free to do so. My husband Thomas and our two daughters, Taylor and Trinity, we're currently in transition to the community. We look forward to becoming a part of the community officially soon. With regards to housing, I did share with Chair McCall where we are in the housing process as well. And I also know what it's like to serve not only as a superintendent and working in public schools for the past 17 years, but my husband Thomas, he currently serves as a town commissioner. So he's in service as well. So once again, I do know the work that you all do, and I respect you for that. And I thank you for your time this evening, for allowing me to have time to speak on your agenda and just to lay my eyes on you, as some folks would say, until we meet again one-on-one individually. So thank you, Chair McCall, for allowing me time on the agenda this evening.
Well, you're most welcome. Thank you. I think I'll ask each of us to introduce ourselves so you can put a name with our face.
Absolutely.
And you want to start down there, Jason?
Sure. I am Jason Robinson. I'm the clerk of the board of commissioners.
Thank you for great directions, Jason. I got it.
Oh, thank you. I'm glad. I see that you got here, so I did good.
Okay.
Kevin Patterson, County Manager. And you and Corey and I have been talking a lot, so soon you and I will.
Yes, we will. Yes.
All right, wait a minute, and go ahead, Eric.
Dr. Grant, I'm Ed Johnston, County Attorney. Dr. Grant, I'm Whit Gibson. I'm a county commissioner, been here for, been in Harbor, grew up here, moved away, came back, been here about 40 years.
Dr. Grant, I'm Darrell B.J. Gibson.
And I am Tim Ivey.
And I'll let the,
Oh,
you need to know the woman behind you as well.
I'm April State, I'm the DSS Director and Transportation.
Awesome. Thank you for your service.
And then,
And Dr. Grant, I'm Brandon Rear. I'm Clarence McFadden.
Thank you for holding the door, making sure I was in the right building, I was in the direction. So thank you for confirmation.
Thank you.
thank you for being with us. We look forward to working with you and seeing you as the months and years go by. Thank you very much.
Thank you, Chair McCall. Y'all enjoy the rest of your meeting.
Thank you.
Okay, next we will hear from April Sneed, our DFS Director, to give us some more information about staff.
Yes, ma'am. Good evening. Hey, wanted to come back and follow up from last month. Last month I couldn't be here in person. And I know it's hard to hear, and it's hard to hear you also. I wanted to come back and give you a little bit of information about stats and follow up to our public hearing on our fixed line. So just a little backup on this fixed line public hearing. I posted that again in the newspaper in December, and it's run at least a few more days than that now. And we posted it also in all our SCAT vans, all our exteriors and within DSS. And of course, like I said in the newspaper, try to get that word out there so people have different ways of seeing and hearing that. So SCAT services, one thing we mentioned last month was in Scotland County, we realized there's a gap in transportation services. We realize that. And at this point, can we fill every gap? Probably not. I think it might have been Ms. Riley who mentioned like Sneads Road. Somebody mentioned that. So we recognize there's going to be a few gaps, but we're working slowly to fill those in and improve services in Scotland County. But what I do want you to know very quickly are the services that we already provide beyond the fixed line. So we provide medical trips. We run dialysis buses every day of the week, Monday through Friday. We run two trips every day according to when people go to dialysis. They start at 4:30 a.m. to get people to dialysis center. So we do that, but then we also do all other medical trips for the county that people can get on. We have 3 different funding sources for that. So very few people would be left out of getting somewhere they need for a medical appointment. We also run out-of-town trips to Duke, Chapel Hill, Moore County, and we recently added Fayetteville to capture people going to Cape Fear or our veterans who may need to get to the hospital up there. So we do that at least once a month, those out-of-county trips, and medicals every day, of course. We are starting now employment trips. Scotland County gets funding to take people to employment. That's never really been tapped into before. And so we're going to try to tap into that more and more. So right now, our reentry program works well with SCATs and those reentry participants. We're providing some rides to get them to employment because they need to be successful. They need jobs. They need to get there. So that's something slow. We're advertising that cautiously. And I say cautiously because we only have so many drivers, only have so many vans. We're still under COVID restrictions, but we want to get that started more and more. Then we have our elderly and disabled trips, and that's funding for the elderly and disabled who just need to get almost anywhere. So like their errands, their shopping, their grocery store, personal appointments, we can take them there by appointment. And then, like I said, we have our fixed line. We're going to talk about some tonight. And then part of the fixed line, that very last part at the bottom that says a deviation for elderly and disabled, even on the fixed line, let's say it stops at Central Schools, but somebody lives within 3/4 mile and can't get to Central School, we can deviate up to 3/4 mile and pick that person up and stay on our fixed line and take them where they need to go.
So that's outside of elderly and disabled trips?
That fixed line, that deviation?
No, yeah, well, I'm talking about the one above the fixed line. The elderly and disabled on the shopping and stuff, do they have to live on the line or get to the line?
No, that's a whole
Or they can
different
call anywhere in the county?
Yes. From medical to elderly and disabled are by appointment. You call us within so many days in advance, and we're going to put you on the schedule where we get you there and get you home.
From anywhere in the county?
Yes.
You mentioned the COVID restrictions. Does that limit the number of people you can put on the bus?
We do. And DOT hasn't said you have to follow X, Y, and Z restrictions, but they've left it to local departments to decide what we need to do. Well, of course, we need to follow the governor's orders. So there are, I guess you'd say, restrictions out there that we follow. And so our buses seat about 15 people. That also holds a wheelchair that takes away from the 15. And so we have to make sure they're spaced out, required to wear a mask. You know, we have all the signage up. If you're sick, don't get on the bus. Do the best we can. And we have had some incidences where somebody has called and said, I rode your bus 2 days ago and I had COVID. So we go through our protocol for what we do to manage that as well. Okay, so that's services we're currently providing. And now we'll talk about our fixed route. So brief history on the fixed route. this used to be called the red and blue line. If anybody remembers that or remembers seeing signs for that, those red and blue lines have not run in well over a year. And I think that started at some point based on staffing shortages. And then, of course, DSS took over stats in January. And so we're at a place where we're trying to get those going again like they should look. And then we got hit with COVID on top of some staffing shortages. So now we have staffed up. We have our full-time staff in place. We have part-time staff in place. And we are ready to run those lines as we would like them all day, 2 lines running. So again, I mentioned the deviation, and I mentioned how we posted for public comment in November and December. So one of the things that was mentioned at our last meeting was, at your last meeting, was a couple of the stops that we said had been rerouted. And so there were concerns about how far somebody would have to walk to where we had rerouted or where those were at. So I hope this looks better or is easier to follow. But the first one I mentioned was Brothers in the Hood. So I gave you 2 different little visuals here. And so one on the left, you see the red dot represents Brothers in the Hood. So we're stopping at the apartment complex that are really across the road from Brothers in the Hood. And we like stopping in an apartment complex because we can serve more people. More people will congregate to that stopping point, and you can see it's only 0.2 miles from Brothers in the Hood. So we're still in the same area, but we hope more people might get on the bus and get to places. So that's that one. The next one we talked about was Rob's Convenience. And so Rob's Convenience, you see where it is, the little red dot. One that's not on here, we stop at Partners in Ministry. Then you come up the road. We were at one time stopping at Rob's Convenience, I guess a couple of years ago. And so we're going to stop at Partners in Ministry, and we're going to stop right there where that other dot is. And that is where the sheriff's office sits, the courthouse sits, the jail sits, and the annex sits. So somebody, and that's also 0.2 miles from Rob's Convenience. So we thought stopping at that cluster of county buildings and the courthouse, people would get off. They might have business there during the day. So that's a 0.2 mile walk. And then the next one, I highlighted anyway. I'm not sure that anybody spoke about it too much. There was this odd stop, and I think it was just because of the way the route was running, that was on Produce Market Road and Purcell Street. And it's just this random stop. We moved it to Market Park because it's in 0.4 miles, and we thought people might take advantage of Market Park. They might get off there. And so that's where we rerouted it to. And it flows on our route because we're going to keep going down Lakesville Road out towards Highland Village. So I'll pause there for any questions or, and then your last page, I just put the entire schedule in for everybody.
Hey, we did have
We didn't get that, or I didn't get that page.
I didn't get it, but this person saw it.
That's
No,
what
you
I'm-
didn't.
that's what-
I apologize. You did not get this. And I'll be glad to send it to you. Because once we decide we're good, we're going to try to go ahead and get this out in the community. We have to wait 30 days from today, from the public hearing date, to change the route. And so even if we decide today, hey, we're ready to try this, we've got to wait 30 days before we can start it.
people, I'm not familiar. Do you have seating area like, I'm in the chart, where you show Rob Convenience Store? All right, you gotta walk all the way back from Rob, not saying, you gotta go to Rob, you gotta walk all the way back down to the courthouse building.
Right.
Is there, have y'all ever considered putting a station there, like bench, maybe a shed or something, where they can stop and, I mean, you may have some elderly or some handicapped, not really handicapped, a person may have had a stroke.
I
And
agree,
say, well, I can make it that far.
I agree.
And I don't,
And one thing we would do, our drivers would know, if somebody, they see somebody in that, medical condition trying to get on the van, we would let them know, you can sign up and you're gonna qualify for us to come to your house and pick you up.
okay.
Which is part of what I described in the beginning. We'll just go pick you up by appointment. You don't have to wait for like a bus. But talking about shelters and
Yeah.
benches, that's something we would love to look into. And we talked about that. We have to get in conjunction with the city of Laurinburg, because of course we're stopping on most of their streets and learn rules for where you can put them and things like that. We talked about that.
Because I mean, looking at the chart, I'm gonna be honest with you, I'll kind of be a little afraid to go to Boys in the Hood.
Mm-hmm.
Like I said, their property that's in front of Boys in the Hood, in between the projects.
Mm-hmm.
I can see a lot of people are either stopping somewhere near the project, like the site,
Mm-hmm.
against it, like they do in the bigger cities. They
Right.
have a little site for the bus stop and pick them up. I kind of,
I
I
definitely,
don't feel more safe if I was in a position to want to at least go somewhere other than, that site.
right in front of the store.
Yeah.
Well, I think that's why when we look at where are we gonna stop, we look at pedestrian safety, driver safety, traffic safety. We look at what is the most bang for your buck?
Right.
Who can we serve the most people if we stop here? I'm not saying that very eloquently. And then when we're letting people off, where can people get the most services if we stop there? Well, if you stop at Walmart, they can get a pharmacy, food, supplies, almost anything you need. So those kind of things go into when we're making decisions about stops.
After this route is run, and this starts at 9 and ends at 10:57, do they immediately?
They do.
So they
So-
make what, 4 trips a day, 5 trips a day?
Right, really, and 8, because you've got two
Got 2
buses
buses.
doing the same route.
So the other bus would be leaving this same site at 10 o'clock.
Right, I think about 30 minutes later, right. And at 30 minutes to an hour later, and then stop. So people shouldn't have to wait too terribly long. And then I'll remind you at the bottom, if you can see that, Tuesdays we're going out to Gibson, Wednesdays Laurel Hill, and Thursday we're going out to Waverly. To bring those people into town.
Well, what does that mean? You go to Wagram and you bring those people where?
We're gonna go to Waverly and pick them up, ride through our route, pick
Okay,
them back up, and take them back to Waverly. So that is not the best scenario ever for those people,
but it's a
but it
start.
gets them into town and it's a start. We've never done it before.
Right, I think you gotta
Scotland
begin
County-
somewhere.
Yeah.
All the people that fall into the gap of non-medical, non-disabled, it gets them into town once a week. And so if we see the numbers on that like spike, we'll see if we can expand that.
April,
Yes, ma'am.
what day you coming away from?
Thursday,
Thursday, okay. And what time is the bus gonna be there?
so our buses out to these outer areas will be there around 8:30, 8:15 or 8:30. We have to
Okay.
pick those
All
residents
right.
up first so we can stay on schedule but get them into town as well.
And then you take them
And
back.
that's at City Hall in Waco, right?
Yes,
Is
ma'am.
that-
Yes,
is City
yes, ma'am.
Hall?
In Waverham, it is at the city
Okay,
or the town,
All right.
the
Thank you
town
so much.
office. At Laurel Hill,
I
it's
really
gonna be,
appreciate it.
Go ahead.
at Laurel Hill, it's gonna be at the community center. At, at Waverham, it's gonna be at the community center. And in Gibson, it's gonna be at the town hall. We wanted to use our county sites that are already
When
established.
you say community center, you mean the recreation center?
Yes, ma'am.
Yes.
The recreation center, okay, because we have 2 buildings there, I have to distinguish which one you're talking about.
And
Okay,
we'll put,
recreation center.
and we'll put a sign up as well, so people will know where it's gonna stop.
Okay, thank you. I appreciate you, getting Wakeman involved. Thank you so much.
Yes, ma'am.
And I assume you'll change this NC work since it's moved, and it moved now.
It will be moving, I believe, in February.
It will be moving,
I thought it-
and we thought about that because our bus doesn't run way out there.
I was
But
gonna say, it
those,
doesn't go out
but
there.
those people can be called on our employment services.
Okay.
They can be taken to NC Works by appointment.
Okay, any more questions, comments? April, thank you. Excellent report, lots of good information. You have certainly listened to what we said last month, and I'm speaking for myself, and I think the remainder of the board, very appreciative of that. I know we challenged you a little bit a month ago, but, anyway, I think we have got a good return on that challenge, and I'm very pleased, to see what will be happening in 30 days, hopefully.
Okay.
And I believe, since it's been advertised for a public hearing, I'm not aware of any comments that have been received.
I did not receive any prior to today.
So,
or open to
we've
it.
not received any at DSS or at clerks, which would have been the means of, receipt. So, it would be up to the board for approval.
So we can go ahead and approve that tonight.
Yes, unless there's someone online that wants to make a comment.
Well, we do not have anyone online that wants to make a comment, so we are ready to entertain an approval for this, updated SCAPS route and presentation.
I move approval.
All right, we have a motion from Ms. Goldston to approve. Do I have a second?
Second. John Alford.
John Alford, second. All right, with a motion and a second, any more comments or discussion? All those in favor say aye.
Aye.
Opposed, like sign. The motion has carried. Don't go away. All right. At this time, I'm really pleased to present an award to Scotland County. Our department, our DSS department is really very, eager to improve their services, and they have been recognized for doing that. This letter has come from us from local government federal credit union that awards excellence and innovation every year at the annual meeting in August. Well, obviously, there was not an annual meeting in August this year, but the award did go forward. So I'll read part of what this letter says. Dear Scotland County Board of Commissioners, on behalf of the North Carolina Association of County Commissioners and the local government federal credit union, we are writing to congratulate you on the excellent work being done in your county. As you may already know, the LEAP, L-I-E-A-P, which is an energy assistance program, into the community program led by Scotland County DSS, was a recipient of the 2020 Excellence and Innovation Award from the local government federal credit union and the North Carolina Association of County Commissioners. This program was chosen by judges who work in county government across North Carolina, and it was featured during the NCACC's virtual annual conference. So I want to congratulate you. Here is, you have received a monetary gift, and this is your trophy. Recognizes Scotland County for development and implementation of the LIEAP into the community. The team members were April Sneed, Joy Hine, Nicole Yarborough, Ken McCrae, Richard Ramsey, Francis McLean, Antonio Rayner, Mary Bender, and Falana Jackson. And April, I think I'm correct in that the reason that you initiated this program was that you did not feel like that a lot of participants from Scotland County were utilizing this available money for energy assistance. So you went out into the communities, various locations throughout Scotland County, and did outreach so that more people could be made available to the money. Is that correct?
That's correct. And especially our elderly and disabled.
So you actually went to some of the housing places where the elderly live. Okay, that's what I
Yes.
thought. That's what I
And we took applications on site, and last year was the first year Scotland County expended their complete LEAP allocation. And we attribute a lot of it to that. They couldn't get to DSS, so we took it to them.
Is this something you're going to continue doing every year?
We
going out?
will, and we would have done that this year, however, COVID. And this year, if you remember, but based on COVID, all those recipients, elderly and disabled who received last year, automatically received this year.
Well, the timeliness of that cannot be overstated then.
No, it couldn't, like it was the perfect year to do that because they all got it again. And today started LEAP for the entire community, not limited to a special population. And so I think by 9 o'clock a.m., we had already taken 65 applications at the department. And so I didn't get the total at the end of the day, but by 12, I think we're up to 100. So people can call in and make an application. They can go online, or of course they can visit our office. So.
And LEAP is Low Income Energy Assistance Program that's been with us probably 5 years.
As long as
A
I know.
long time. So congratulations to you and your staff here at the trophy. And I'm glad that we had the opportunity to recognize the work that you're doing.
Thank you so much.
Thank you. All right. I think we're ready now to have our conversation on the mass gathering ordinance. And Mr. Johnson, are you ready?
I am.
Okay.
Thank you, Madam Chair.
All right.
Can everyone hear me with this mask? As you may recall, at your December 7th, 2020 regular meeting, at the urging of the governor, the board considered what I would denominate a generic mass gathering ordinance. The ordinance had been forwarded to us from the North Carolina Department of Health and Human Services. The board had lengthy conversation about the proposed ordinance, and frankly, there were a number of good suggestions made to improve the ordinance, not really to make substantive changes to it, but to make minor improvements, sort of tweaking the ordinance. As I understood my charge from the board at that meeting, I was not to change the thrust of the ordinance, but to incorporate into a revised version of the proposed ordinance some fine tuning that was in accord with suggestions from board members. Some examples of the minor changes that I incorporated. This is not intended as a exhaustive list, but there were an appeals process was one that was included, and then one of the board members had suggested that some of the language incorporate into the ordinance support for officers who might be tasked with enforcing the ordinance, and basically encouraging the officers to exercise their inherent authority to disperse crowds. So what you have in your packet really is a beefed up version of what was submitted to you at the prior meeting. A lot of the changes were in the preamble, which were the bases for your consideration of the ordinance. In comparing this to some others that have been adopted in other counties, I would say that there are somewhat less stringent enforcement methods, one of which would be a civil penalty. I've seen others that incorporate a civil penalty, but not on an escalating basis, so that every time there's a potential violation, there would be a greater civil penalty, up to and including, I think, through the Greensboro. Actually, I think it was a declaration, but the declaration that was issued there escalated the fines, and also at some point imposed the obligation on a business to not to operate for some period of time. I did not take away from your meeting that any of the board members wanted to incorporate those more stringent provisions into an ordinance. And I think you'll see that the ordinance is mainly an effort to encourage, and this is with the sheriff's knowledge and consent and his preference to not to find some violator, but to educate and encourage compliance. So that's the route that was taken to get the revised ordinance in front of you. Again, not an effort to change substantively the ordinance, but really to give a basis for it and to incorporate some provisions that might address appeals and other things. So that's the comments I would have on it.
All right, I hope, I know I have looked at this ordinance a great deal, I hope those of you have as well. So are there any, comments or questions? I'm just gonna start with you, Rick. You want to just kind of go around the room and give everybody an opportunity to weigh in on what we have before us.
No, I'm actually pleased with it. I thought it, I didn't think we needed to be overly heavy-handed. I think this does allow for the civil penalties. I think it also communicates that we are concerned about COVID-19 and would like to see the public do everything they can to help us stop that without trying to dictate individual behaviors such as mask wearing. I do think, and I will say that I believe I may have misunderstood something that was said at the meeting a month ago, because I felt like, when we talked about it, that one of the reasons that we needed to go to the ordinance was that it would be able to impact everybody within the county, not just those outside of the municipalities. And as I understand it now, this would still not necessarily dictate the behavior or be enforceable within the municipality.
That's correct.
And that's not the way I understood it at the time. So I was a little, I called Mr. Johnson today and said, did I read this correctly? And he assured me that I did. But I was a little disappointed in that, but I don't think there's anything we can do about that.
No, that's out of our hands, isn't it, Mr. Johnson?
It is, and I think there was some conversation at the last meeting about possible efforts to
Communicate with the municipality.
right, and not necessarily persuade them as to what they should do, but let them know what the county's position, if this is adopted, will be, and maybe have a seamless application if the municipalities want to treat it the same way.
Well, I did reach out to, Waverham and Gibson. I had a conversation with the mayor of Gibson, Eric Stubbs. He was very appreciative of my call. He said that he, as mayor of Gibson, had worked with their law enforcement down there as to what their responsibilities were and to what their authority was. I told him that if he felt like there was more that they needed from the county to let us know that we all needed to be together and working with them. And he said that he would. I've not heard back from him. I also spoke with the mayor of Waverham, Mr. Milton Farmer. He too was very appreciative of my reaching out to him. He recognized what we were trying to do. He was appreciative that the county was looking at this and working on it. He did not offer up exactly what Waverham's position or direction was going to be, but I left the door open for them to reach back to us if they felt like that they wanted to create a coordinated effort. So that, we did reach out. I did reach out to those two municipalities in Scotland County. As an FYI and as a way to say, we can do this together, we can just letting you know that we're addressing it and taking it seriously, and they were very appreciative of that, but they did not, I've not heard back from them in any way as to what they would like to do in coordination. So, anything else?
There were a couple of kind of just things that came to mind when I was reading it, and when I talked to Mr. Johnson, he was all well, and I was comfortable with the orders, pretty much like it is.
Okay. Mr. C.J. Gibson, do you have, what would you like
I
to
do,
say?
much of what Mr. Whitgift has said,
Uh-huh.
is part of the things that I would reiterate, so I won't, because of time. I am glad that we're hopefully gonna move forward, because something has to be done, to help, mitigate the spread of COVID-19. I do hope that we can follow up with those municipalities and actually say, this is what we've passed,
We will.
and hopefully you all will do something. I've talked to a few leaders in our municipalities who I think would be open to doing something if we have that direct conversation. Otherwise, I'm comfortable with it as it is.
Okay. Right. Yeah, if we, depending on the action of the board tonight, obviously that information will be shared with other leaders in the community as well as our citizens, and we'll go from there. Okay. All right, Mr. Ivey.
Well, I think the city of Laurinburg had their meeting after hours last time and decided not to do it at that time. I know it's right, I watched it, so.
Yeah, there was no action taken.
There was nothing done. I didn't know if they had made sense, so.
And I've not heard, and I left out the fact, when I obviously have spoken with Mr. Stubbs and Mr. Farmer, I also talked with Charles Nichols and the mayor. And just, it was more of, this is where the county is, this is what our board is thinking, these are the conversations we've had, and this is the direction we're going. And their response was, that sounds good, thank you, well, that was.
But I mean, if they don't get on board with it.
It's pointless.
They didn't, they weren't opposed to it, but they were not thinking that we would work in unison on
I
it.
got you.
Is what I took from it.
I sent to everybody, and I thought would have been included on the pack, that attorney's opinion on, UNC School of Government, on both the emergency declaration and the ordinance. And the only reason it concerns me is from the legal side of basically in both cases, he says it's not legal to do that. And, it's not within our authority to do that. And that's also been the message relayed from the legislature about it. But irregardless of that, the thing I would want to see, if we're going to depend on the governor's attorney, and I don't know if he's with the attorney general's office or who he is.
I think the governor's legal counsel and the attorney general, well, in addition to the governor, there's an attorney as well.
Yeah, but
There was definite urging from his office in a letter, and also in the executive order.
right, well, I think we have his list.
Yeah, but and it's, I think it's executive order 181 that specifically encouraged counties to do it. There's clearly a division on whether there's a challengeable, and I would say this as far as I think if the board decides to do this ordinance, this would be how we proceed, and if the board decided to do this, there would be no reason to continue with the amended emergency law.
Right.
So that, I would suggest to the board chair that be rescinded if this.
But that could be done in the motion at the time.
Right, but I think
I may not be right, I'm saying, am I?
You are, I think that's what we should do.
I think if you choose to go the route of the ordinance, it's still controversial. There's a division, as you just pointed out, of legal authority on that. But I think the ordinance is more defensible as a standalone.
I mean, the only thing that would make me feel better about it, from that standpoint, I'm not talking about the wording in the ordinance.
Right.
Is that general counsel for the office of the governor, instead of saying, and I know he's doing the attorney thing,
Well, and the AG, and the assistant AG.
yeah, and is that they would offer to defend us when something happens because we follow their guide. I mean, they don't say that. And of course, we haven't had anybody that I know of that's been issued a citation for.
Has not occurred.
Well, so, until somebody really does, they don't have standing.
And I think that's the only way it's gonna be decided.
Right, but it could be ended up, it could end up with a declaratory judgment, correct me if I'm wrong, which is somebody from Charlotte to come here and sue us over.
Well, I think your point's well taken, that you would expect the governor's counsel and perhaps the AG's office given the positions that they have stated to want to defend.
They won't defend it, right, and they go to great lengths not to defend it, or just not to say they won't defend it. So, that concerns me, that part of it concerns me. Not the ordinance itself, but this, but anyway, that's all I had to say. I mean, that was what I had to say about this.
Well, I mean, I think we're caught in the middle, and that seems to be where counties are all the time, anyway. And we're not here in a position to decide who has the ultimate authority. That's not our role, and we're navigating these waters along with 99 other counties, trying to do the best we can.
I just want somebody to come in and rule this.
Okay, Mr.
Item number 3 and number 4,
Uh-huh,
under executive order,
uh-huh.
I'm a little confused about, 3, especially the 3 and 4, when they talk about mass gathering, 10 people indoors, 50 people outdoors.
Mhm.
It's used, for example, cemeteries. We have funerals out there. It's unlimited. It's unlimited. Whoever chooses to walk up in space, yeah, for a funeral.
I think there's an exception, so that the funerals are not included as mass gatherings under things like worship, religious, spiritual gatherings, funeral ceremonies, wedding ceremonies. So I think,
That
at
is
least under this one, yes.
Okay.
As it's written.
A lot of people been asking me, and I just said, look, it's not my cemetery. I can't enforce anything. I'll enforce what happened at the funeral home. That's why I try to stay neutral, because you confusing you're it's lost business. Sometimes you act upon it and say, well, I act on it. I go by 10 person rule at my funeral home, and but like I say, I see it happen a lot. How can you enforce? But I understand now it's done.
There may be something in existing orders from the governor or future orders from the governor that would change something at the state level, but funeral services should not be impacted by this order.
Yes, sir. Okay.
As it's written.
Other than that, I fully agree with everything.
So, Mr. McFadden, funeral services, like in your business, is that limited or is that excluded? Because the way I read that is excluded, but I don't know. I'm asking from a point of ignorance. So,
I try to abide by the
right.
executive order and be safe, because, some facilities is not large,
Right.
accommodate.
Right. I just didn't know. I had no idea. I thought they were limited. But
Like I said, I enforce that rule. But
I got you.
my location, because
Well, I know
I'm
it's a
trying to be
challenge
safe.
for you and your industry, and
Yeah.
I'm grateful for what you have had to do this last 9 months. Whew. All right, Betty, can you hear me? Would you like to comment?
Yes, I remember about 2 months ago, I was listening to Dr. Cohen on television for the governor's office. And at this point, she was encouraging commissioners of county officials city officials to do some ordinances to help the situation with the COVID-19. And, I called Kelly and told him I heard that, and so we got to go together, and I was so proud of the fact that the commissioners really wanted to do this, because it's something that needs to be done. We losing too many people are suffering, and the county commissioners really need to take a stand. Yeah, we may end up in a lawsuit at some point, but this is to show that we are here for the people of Stockton County, and I really think we need to pass the ordinance.
Okay. Thank you, Betty. John, are you here with us? You want to make a comment?
Yes, I'm with you. Yes, and I would like to just briefly say that this virus doesn't care whether you have an ordinance or my lawsuit, it attacks our immune system and it kills us. And, our lives is much more than a lawsuit or anything that could come against us. Because the person that died would be you or me. And I think it's vitally important that we pass this ordinance and support everyone that's fighting, especially the first responders and other people who are trying to keep folk alive, because it's worse now. Pandemic is worse today than ever. People are dying every 10 minutes from this virus. So I want to thank the board and Ed for all the hard work you've done. And I'm sure tonight we're going to pass this ordinance for the betterment of all humankind here in our county. Thank you.
Okay, I think we've heard from everyone. My question to, our board attorney is that we're not taking action yet, assuming that we take action, that was not immediately, void the declaration. I would need to take further steps sometime tomorrow.
Right.
And in that declaration at the time.
Yes, ma'am.
Okay, would that be the pleasure?
But I thought we could just talk about that we could make it as part of the motion that declaration be rolled back.
It
without-
could be.
And I would make that motion,
Okay, all
that
right.
we approve this ordinance and request of the chair that she, with rescind the order that she entered into.
We can draft something to
Okay.
do that.
Okay, so are you willing to make that now?
I'm making that now.
I second.
I was just making sure this.
Okay, so
I look like you.
I'm working. We'll slow down. So my understanding is that the motion's been made by Commissioner Gibson that, we approved the ordinance that's presented to us tonight, including in it that it would, render the declaration null and void.
It would roll back.
It
That
would
was
roll-
amended.
Made in December.
Right.
Right,
Yeah,
yeah,
I spoke
not
to-
null.
Yeah, no. It rolls back the amendment that was signed on December the, whatever. Yeah,
2020.
right.
Number 7.
Okay, all right, so we, I think we're clear on the motion. Thank you. Do we have a second?
Second.
Have a second from Commissioner B.J. Gibson. All right, any other comments? Good discussion? All those in favor say aye.
Aye.
Opposed, like sign.
Aye.
Motion has carried unanimously. Thank you, Commissioners. Good work. Okay. All right, let's hear about the Laurel Hill Community Center.
Okay. With that, I have received a link with information, from the architects. Our goal is to schedule a meeting, in the next week or two to, work on that. But in part of this, and I will forward, I don't remember if I did forward this information this afternoon.
You did not.
Okay, but I will forward this information to the board. Also, just sharing some of the images. This is not all that they sent, but just two of the, the front scope and the gym. But just some images for it, but basically we will be having a meeting with the architects virtually in the next 2 weeks to sit down and figure out the next plans, finalize everything so we can go get the plans ready for bid.
The architects are gonna make the bid or we do the bid.
We work with the architect.
Okay.
So they'll be bidding by February, if not complete.
We'll have to get with them. I'd rather them give me a date than, Maybe before
Give them
we-
a date. and then-
Yeah.
Yeah,
well, before I lie to you.
I know, don't lie to me, but give them the date.
Yeah. So,
All right, so we're making progress.
There
We
you
have
go.
images to look at. of the Laurel Hill Community Center.
And you will send that to us?
Yes.
People have asked for it.
Yeah, I'll send this, and like I said, it came to me, I downloaded the zip file this afternoon, and, there's a lot of information to just go through and figure out which parts to send.
You got that today?
Yes.
All right, moving forward, there are no appointments at
There are
this
no
time,
more,
so.
there will be appointments next month.
Can I ask a question on that? And maybe it's to Jason or maybe not, but, and I'll use Sam as an example, Creed. He did not get a letter about being appointed on a historic property, and he has no email address. So do we send out a letter to these folks when they get appointed or approved or not approved, or should that be the board or?
I usually don't, I sometimes send an email if they, have an email.
Right.
But.
I'm asking for process. 'cause I
Yeah,
don't know.
and that's something that I probably should do, is. to-
I'm actually
I
trying to
have-
load your wagon, I'm just,
I think.
or maybe it goes back to the board to do, one that they're being appointed.
And, usually, whenever there's an appointment that comes up, I've talked to the vice chair and they've talked to the person.
Right.
And, unless there's some unreasonable, something that happens, they know that they're probably gonna get appointed. And so, but but I would be glad to send a letter, because it'd just be a form letter.
Well, I
And I'm not saying you gotta do it, I'm
No.
saying maybe that board.
I think it's a great point. And that if Sam Cribb is willing to serve and he's made application and we thought enough of him to appoint him, I think it improves his status and ours to send him something official and congratulate him and to thank him for being willing to serve. I think it ought to be a kind of a formal process that takes place anytime we appoint somebody. That would be my suggestion.
Can we start doing that, Jason?
Yeah, like I said, it'd just be a form letter.
Okay.
I would just insert the name and
And then they have
whatever board.
and they have documentation of their appointment, all right?
My question, Jason, is how does the general public know when there's a vacancy for them to even apply for a board?
It's part of every meeting.
Is the website current yet?
With our vacancies. I mean, I have done this for a long time, and when we have vacancies, I report it at a monthly meeting. Whether or not it gets reported by the media, I don't know, but I mean, it is part of the ongoing process of a monthly meeting as what vacancies there are. Currently, the majority of our boards are full.
Yeah.
And we have worked.
The only
hard.
vacancy that we currently have right now is that weird, zoning.
The ETJ.
The ETJ, where you have to live, you can't live in the city, but you have to live, but you can't live more than a mile outside the city. You have to live a mile within the city. That's the only one that I know that we've got open right now.
It used to be on the website, the boards, and whether or not, and didn't say whether or not there were vacancies on those boards? Is that still there?
Not, it has never been that way since I've been here.
I think it's something to work toward, because I know other counties, I've looked at their websites, and they list their boards and their board memberships. And that might be a goal for 2021, is to get that on the website of what boards we have and who serves on those boards. And then
City
people will
does
know.
that, I don't know if it's up to date, but I know they have that.
It's, the challenge is keeping it up.
I was gonna say, the hard part's keeping it.
Keeping it up. I think that's an excellent point, Tim. So, do you have a mailing address for Sam? By any chance?
Oh, I do.
It'd be on the application.
Yeah, I've got it.
I don't know where you're living.
Yeah, I've got it.
I know.
I think it's P.O. Box.
Let me just go back, Mr. McCall, to my point. I do want us to make sure there's a way that the public knows, because most of our boards, from what I'm seeing, are served by the same people over and over and over.
Now, that is-
And prior to my becoming involved now, I would have never known how to be involved on a board. And I think that the citizens need to know if there's a vacancy.
It is a challenge that we have had, that I've been on here for 10 years. And I made a commitment a few years ago that we were gonna get our board memberships at 100%, which we did. But you probably wouldn't be surprised to know how hard it is to get people to serve on boards. I mean, we do have people that continue to serve term after term, but then you try to get somebody new to serve on a board, and they're not out there. I mean, so, I mean, if you can help in that regard, if you know of a way to, let people know, that we have these boards, and if you're willing to serve, let us know, that that's an effort that the board needs to make all the time. I agree with you.
And the application is on the website that they can go to and fill out, that comes to me.
I think you did, some of the problem is people say, I want to be on the board, they get on the board, and that's it, and you show up.
That happens too.
That happens a
Yeah.
lot.
I'll
I
be
know it
about
happened on that monument board, that we had 20-some people on there, and the first one was like 6 of them dropped off, before they ever had the first meeting.
Several. We had several that dropped off before the first meeting, and by the time we had the second meeting, they were under 20.
All right, Kevin, are you ready for our COVID-19?
Okay, very quickly, going with this, as of this morning, from the inception of the pandemic, when we started tracking, there's been over 2,600 cases, 2,646 cases of Scotland County residents that have been identified as having COVID, of which 2,388 have recovered. 55 have passed away, one in the last week. Yeah, and which gives us currently 203 cases, 203 active cases in the county.
Isn't that the most active we've had at one time?
It is. Because with that, we don't, well, if you look at the bottom in the purple column, you will see the number of active cases. And this is last week's numbers, not today's numbers. So you'll see the week of Christmas, it went down to 70 new cases. That's just because it was probably quite difficult to get tested on Christmas Day. And then it spiked back up to 178 new cases in this past week. So
I don't have something. Mine ends with 7, 1228. Oh, you didn't, okay. I'm looking at it on what the packet had.
oh, okay. Yeah, what I sent last week, I prepared before this. So this is our current situation. Right now, the health department is going in training, spending all day training tomorrow on the vaccine. And they are scheduled to do first 1A vaccine clinics Wednesday. We just basically, during the Christmas week, in between the holidays, the number of quarantines that we had going on in the building and everything else, we honestly just didn't have the staff to do a clinic after. We just couldn't do it. But it was planned, so we are going to be doing that. Talking with our director of nursing, Donna Page, who honestly is doing an incredible job with this, just like the rest of the health department is. Right now, the number of people who are in the 1A category that are willing to be, that desire to have the vaccine, we're thinking we will actually be able to go through the 1A category, hopefully by the end of next week. We will be working with one of the nursing homes because they did not get lined up with a pharmacy. So we will be working there.
So does that come out of our 400 allocation?
Yes. But we have also received a second allocation, so we're gonna start receiving a weekly allocation. We don't know what that number is gonna be from week to week. But as we start going through, we'll be able to go through the 1As fairly quickly. And honestly, there's a fairly low acceptance rate. You have a lot of people who don't, your 1As are probably more likely to get it, because those are the ones who are considered direct COVID, people who would directly work with a COVID patient. And of course, the hospital has its own doses. Most long-term care facilities have their own doses. But then when we get into category 1B, and that will be part of the messaging, trying to get out to the community exactly when that starts. That will include people who are 75 and older. Health status doesn't really matter, that is just an age determinant. When you get into group B, that will be 65. Group 2, that would be 65 and older, and at this point in time, we're not certain on when that would happen.
Kim, are your allocations all from the same drug company, or
Yes, we're receiving the Moderna vaccine.
so you won't be getting anything from Pfizer?
We have not gotten anything from Pfizer. But we do believe that basically the state has been trying to guide the Pfizer to your larger urban areas, which has larger medical centers, because the Pfizer is just more complex. Because of the nature that it has to be stored and everything else. If we did receive the Pfizer vaccine, the hospital system, our healthcare system, does have a freezer that can handle the Pfizer vaccine. So if we do receive some, it would not be a waste. We would be working with them. As a matter of fact, we're going to be working on, we've already had joint meetings with the hospital. We will be having another one tomorrow.
I think the Pfizer has to be mixed by a
Yes.
drug system.
Yeah. Yeah, it has to be mixed to a
It has to
pharmacy.
be mixed also, so it, not only the temperature thing, it has to be mixed, it can only be done by pharmacists.
Right.
But it has to be stored at -7.
So,
They're on a lot.
Kevin, go back one slide for just a minute. I didn't get those numbers. Thanks, sir. Okay.
so we will be pushing out that information. And again, 1A, those are the people who are in direct, who are professionally in direct exposure with COVID. So your primary people are going to be that the health department is working with, are of course our clinical staff in the health department and EMS. The hospital system, actually only certain employees will qualify. They cannot give out to their primary care, not necessarily all their primary care doctors. Trying to figure out where someone fits is an interesting jigsaw puzzle on some of this. So sometimes the answers are vague because the
Big
answer
government
is, it
operation.
depends.
I can understand why they think that's so hard.
So,
I know it ain't coming down, but still, it's.
Okay, so like my profession,
Mhm.
it would come from the health department here?
right, yes. So now, like, you would qualify as you're a mortician, but someone who's working on your front end may not qualify.
Like staff member?
Yes.
Okay.
And that depends on exactly how the definitions on what their job duties and things like that. So it's very interesting.
Will all of the vaccinations be done for
That is something that while we're doing the 1As, those will be. But that will be something that we start discussions with about reaching out and having rotating community clinics. And of course, with that, that would also determine exactly how we figure out to do this. And we know we have to be back in 28 days. And so that is one of the things that we will be discussing.
And you have, in other words, it's still to be determined.
That is still to be determined, because that will happen even more when we get into phase 3 and then, or really your phase 3, which is for your general public. Well, phase 3, I think, is 55 and older, and then phase 4 is everybody. But phase 4, the expectations are you can also get it at your local pharmacy. They would have some of these companies that may be doing the testing now might be staged up so that they can do those. So especially, I think that maybe if you could get to the Johnson & Johnson vaccine, which is a single dose, those would probably be better for the community inoculation.
All right. Anybody have any more questions about COVID?
I don't have a COVID, I got a health department question.
Oh, sure, go ahead.
Do we have a director yet?
No.
I'm just kind of curious, I hadn't heard anything about it.
I have nothing, sadly, I have nothing to report at this point in time.
I'm just curious.
I'm sorry to hear that. Okay.
We are not restarting the search yet.
But you are, that makes, that answers that question. Good question, thank you. Anything else, anybody? All right, Ms. Von Kevin, do you have, in your manager's report, I know you need to report stuff, so right on.
Okay, now with this, the COVID release funds that came out of the CARES Act, those funds needed to be expended by December 31st. And for that, as I'd always said, that those funds will be expended by December 31st. And because one of the primary aspects of this is under the federal guidance, they said that public health, and they define public health differently than anybody in this room does, and public safety qualifies, their payroll qualifies as a CARES Act expenditure. So for that reason, that's why that top line is so large, because it was just a clean, easy way of spending those funds. After that, there was a 25% requirement that it be spent to, that 25% be allocated to municipalities. There was no guidance on how this was allocated. So 373,106 was allocated to the municipalities. Actually, that's Laurinburg's and Wadrum's allocation. I did also, and this was as of for the November report. There will be interest that'll be calculated and accrued in the December report. And in December, we did make an allocation to Maxton because they did submit a plan.
Oh my goodness.
They never submitted a plan or information. Also with this, we did do the $125,000 in grants that included $50,000 of grants through this EDC to small businesses, and $75,000 which was allocated to Scotland County United Way, which went out to community partners. $25,800 of that did go to church community services, primarily for rental and utility assistance. Speaking with Denise Reagans last month, I believe, or 2 months ago, she was talking about the needs of those funds. We also discussed, nutrition, and they said, because of CARES Act funding, which went through December 31st, the regional food banks had significant funds, so they had food, that food was not an issue at that point in time. With the extension that was just passed, I'm not sure what nutrition programs would be funded or how that's going to impact into the 2021 or into the 2021 calendar. But with that, of this funds, part of it did go back into utility and rental assistance. Also, the governor has extended the moratorium on evictions for another period of time. So that is still in effect as well. And then, of course, we had another $29,000 of direct expenses that we had allocations for and put in here. Part of the reason I did put the public health safety payroll, just under half of that I did actually put into the budget for, was projected for support in public safety. But again, I went in there, so some of that is still available for other programs that, or other activities that could actually be supplanted later on. So as we go off and start reaching out in any costs for doing community outreach with vaccines, things like that, if there are not other grant funds that we can do to cover it, we could supplant funds around with some of this excess. Two projects that are still going on, one should have been started and should be nearing completion, is installation of technology in courtroom 1 at the courthouse, which would allow for a jury trial with social distancing. This is technology that should also be very beneficial for the courts moving forward. Also, but with, yeah, the big courtroom. So that project should be going on. And of course, the former Chief Justice did put out a requirement for each county to come up with a plan. So we did work with the Judge Futrell, as well as the other judges, clerk of court, to come up with a plan to develop this. And part of it would also include turning the tax office into a jury assembly room, which would also have a video link, or at least be able to be viewed. You could be in there and view what's going on in the courtroom, which would be beneficial in certain circumstances.
Yeah, I spoke with Judge Futrell last week, and he was very complimentary of the efforts that you've made, and very happy with what things have been going.
Good. So, and as soon as we can get that in and up and running, even better. The other project is actually going to be working in this room. We are going to be looking to upgrade the sound system, installing a camera so we can actually have a more functional remote meeting in here. And I've got to I've signed the contract, scope of work, everything. I've just got to get the vendor to give me a project. I work with the vendor on developing a time frame for the project. The other thing in here was we did not know if the Family First Coronavirus Response Act. This was the act that basically created the emergency paid sick leave for businesses of, I think, 50 employees or more. where you had to provide paid for 80 hours of paid sick leave or up to 80 hours of paid sick leave for employees with 5 categories that were COVID-related absences. This act expired on December 31st from review from the School of Government of the act that was passed. There was no extension of this leave there was no extension of this leave. There was no extension of emergency family medical leave act either. This board did pass last June, May or June, a policy that basically implemented this act. But then again, you were required to implement this act. Since it expired on December 31st, I did present a modification of the current policy because it would expire. But it would basically, instead of going to 5 categories, it would be the 4 categories, which are still, if you are have a potential exposure, if you have COVID, if you have a positive test for COVID, or if ultimately, if you're caring for someone who is quarantined with COVID, and our definition is they're a member of your household, or there's somebody who you are the primary caregiver for, it would extend this possibility of leave. The one category that we did not put, that I did not put in here was childcare. Previously, if you lost childcare due to COVID, you could get additional 80 hours, and that was under the direct legislation. My recommendation is not to include that in a local extension. So that's one thing I would present back to the board. I did have some conversations or discussions about doing something very similar, but just doing it through my discretion, administrative leave. But then thinking about it, as long as I was working with first responders, that would have been easy. But once you start expanding that out countywide, discretion can get you, can fight you in the good intention. So having a policy would be beneficial. So, and since this is a modification of the existing policy, it was not brought back to the policy committee. So this is my recommendation to the board.
Thank you, Kevin. Anybody have any questions or comments on the expenditure of funds? And then in addition to that, on the amended leave policy that covers COVID for our county employees? And do you all understand everything that you've read and that Kevin has gone on?
And you've got it expiring on the policy in June, right?
Yes.
I just saw it.
June 30th. And I plugged that date in there.
Just to have.
And I'm assuming by that point in time, this should be I'm optimistic that we should be well in process of being under control, if not under.
So we do need to act on the recommendation of the amended leave policy. So.
Make motion to approve the county manager's amended leave policy. Did I say that right?
Yes, sir. Second.
Okay, we have a motion to approve and a second. Any more comments or discussion? All those in favor say aye.
Aye.
Opposed, like sign. Motion carries.
One other thing, I was asked to clean back over, was additional funds that are out there for housing and utility assistance, especially the programs for people to remain in their homes to avoid evictions. There were state dollars that had a program, NC Hope, that was designed to keep people from having evictions. They could have taken up to, I believe, 6 months of rental assistance. That program actually stopped receiving applications November 11th. Basically, they ran out of money. So with that, on the local level, that is part of the reason why some of the allocations, some of these funds were allocated to church community services, pushing in there. And we have that. The energy assistance programs, of course, LEAP is coming out again now. A lot of people who have received, of course, people who have received that in the past should get a new allocation of that. In fact, automatically, they do not need to reapply, or do they need to reapply?
For the general population that started today, there was no automatic payments.
I'm talking about if I receive the benefit, would I receive again, or would I need to reapply?
No, you have to reapply.
Okay.
Starting today, you have to reapply.
Okay. So people who are delinquent in there, and there are medical conditions, there are stipulations with this program, but that is there. And of course, in conversations with church community services, I think their financial resources are continually stressed for this assistance. But right, and again, it greatly depends on exactly what federal programs come out and how those funds are allocated back into the state and how they're further allocated. But there would be, like I said, the previous dollars were basically pledged through December. Pledged in the middle of November, and that just goes with the demand statewide or nationally for assistance for housing and utilities. And until there's additional significant dollars from a state or federal level that's made available, that's the additional assistance out there is still going to be, unfortunately, very strained at this point in time. Like I said before, church community services, regional food banks, they did have significant funds for the purchase of food. I'm not sure exactly when those grant dollars would be maxed out also. So this is going to be a continuing issue for the next several months until basically you have a number of states that are opening up and locally we can get back into a normal routine. And of course, the people who are going to be most displaced or have been most displaced are the people who are on the lower economic scale. And they are always the slowest to recover from any recession. A number of your, it's not exclusive, but because you have small business owners who have taken significant hits on this, but your white collar professionals were not significantly, may not have been significantly financially impacted. So this is going to be a very skewed recession even though we may not have a recession by economic definition. As a matter of fact, our sales taxes for the last couple of months have been stable. So, and that is a very positive news for our budget.
Kelvin,
Yes,
I called you the other day, and you gave me a good answer to, the situation, Scotland County we have a lot of poverty in Scotland County. And if people don't have food, if people don't have a place to stay, problems that you hear about on television all the time, what, can they contact churches, the churches, community churches and community centers that do, supply food for the community? How do they go
Yes.
about it? They don't have
the
food
pro,
for the families, or you have the homeless and all that group of people. How would the people in Scotland County, get help? That's what I
the
asked
pro,
you. You gave us the answer.
yeah, the primary contact right now is going to continue to be church community services. Because they've been working with other agencies, trying to find additional programs, because there are some other programs that would actually extend it out until 2021, 2022 calendar years. And so church community services is still going to be one of those better contacts. Also, for people who are looking for services, if you call 211, that is the statewide information network. They can also assist you in contacting regional food banks, looking for other grant programs that are out there. If there's someone who is in a social need, or they need mental health work, or something, or any other service, 211 can help provide that. One of the things that also that was done with the community grants to United Way, part of that funding also went to Scotland Family Counseling. Because of the specific demand that we've seen in mental health services, especially in family support during this time, because you have people who are losing their jobs, which is a significant cause of family crisis, as well as substance abuse is going to continue, is rising during this pandemic, and is going to continue to rise probably for some period even after the pandemic ends. So that's, my funds were also allocated back into mental health as well. So, but for local services, for the community, some of it is honestly, the quick answer is call 211. They have access to a statewide database of resources. After that, one of the local access points is Church Community Services, but their financial resources are going to be limited, so they may give you a referral to another program that they are aware of. But I know they are working with other agencies.
Okay, any other questions for Kevin? All right, lots of information. All right, at this time, we'll hear from our county commissioners. I will go first. The chair of the board has the opportunity to make appointments to the Economic Development Corporation Board. And at this time, I, with that designation being to the chair, going to reappoint myself and Commissioner Rick Gibson back to the EDC board, and also the chair of the Commissioners Board appoints the chair of the EDC board. And I have asked, and he has accepted Commissioner Whit Gibson will serve as chair of the EDC board for the year 2021. So those are two appointments that are being made tonight. And other than that, I have no other comments to make. And Clarence, you want to go next?
No, I don't.
Have something to say? All right, Tim?
I just want to say, and I don't know if Brian is on the line still, Hammond Park is going to have their ribbon cutting ceremony Wednesday. It was supposed to be in the middle of December, but the rain, we had to cancel it. I was supposed to be at that one. I cannot be there Wednesday.
I can do it. What
So
time?
if somebody could be, I don't know, Brian, are you still on? He was earlier.
Originally in December, I think it was 1 o'clock. We can confirm and,
Yeah, by Wednesday, you can get the time.
Yeah.
But
Give me a time.
it's either 11 or.
yeah.
I know I told him I couldn't be there.
Thank you for bringing that up. Is there any comments? No? Mr. Gibson?
I'm good, thank you.
Well, we've heard from everybody tonight.
Betty
Yeah, Betty, I'm sorry. Betty, you have anything else you want to add for us tonight?
Well, number one, I didn't understand, Tim, we said there's gonna be a ribbon cut, I didn't hear that, what it was.
Hammond Park,
What?
where they,
Okay.
yeah, where they put in the new equipment, the new shelter at Hammond Park.
It is Wednesday at 2
Okay.
o'clock.
Oh, okay.
I'm sorry, Wednesday, 2 o'clock.
Yeah, 2 o'clock.
I would like to say that I want to thank Kevin for the good job he's been doing with all this COVID-19, the health department, sharing that area. And, I think he's done a good job with so much information, so much coming through to him now, that he probably never had to do before with all this situation in our economy with COVID-19 and all that. So I just want to thank him for the job that he's doing to keep the county running with all this information, all these situations coming through. So thank you, Kevin.
Thank you.
John, are you still with us?
No.
No? All right. All right, we've heard from everyone tonight. A motion, do we have a motion to adjourn?
So moved.
Motion and second, all those in favor say aye.
Aye.
Opposed, like sign. We're adjourned.
This conference is no longer being recorded.
Hmm.
We will.